One of my favorite treatment modalities to use is cognitive behavior therapy. And the reason why is because some of my favorite clients are clients that have a lot of trauma, a lot of childhood trauma that they've been through. The reason why those are my favorite clients is because I've been through a lot of childhood trauma myself. And so I feel that I can relate to those clients. I'm able to give my guidance based off personal experience, based off my professional experience due to working in child welfare for almost 20 years. And then also just based off of my educational experience. So, learning about the different things that has to do with childhood trauma. So what I like to do is just let the client tell their story and then tell how they respond to certain situations and events that occur. And then what I also try to do is kind of help them understand their feelings and how they're viewing certain events. Maybe they're viewing it in a negative way based off of their prior trauma. So I help them to kind of look at it a different way to have a better positive outlook so that they can continue to move forward and not let that childhood trauma impact them in a negative way in their present and future life. I prefer working with either teenage age or up. So my main clientele, I would say, would be women who have been through a lot of childhood trauma. What I'm drawn to is just understanding some of those impacts that they're currently going through. A lot of times they may suffer anxiety or depression as a result of their past traumas. A lot of times they have relationships they're in that are negatively impacted, based off of their past traumas. So those sort of things pull me in that I can kind of help them to understand it a little bit differently, move a little differently, and act a little bit differently. We have to understand that, some people have a lot of childhood trauma, but then also we have women who go through a lot of relationship trauma. So I'm kind of talking to these women about all those various aspects of their life to kind of provide them the proper guidance so they can have a more positive outlook. They often say to me they can't understand how I understand their feelings or what they're going through. And I always have to let them know, I've been through some things myself, so I understand. And so I think because of what I've been through and with my advice that I give them and the guidance I give them, it really resonates with them. And so they really appreciate that. And it seems to help them. That's what I've been told. So they almost feel, I've heard some clients say, you're reading my mind. And I'm like, no, I'm not. But I just understand, a lot of what they've been through, and I understand the feelings that they have. And I also understand why they may react to certain things in the present time based off what they've been through in the past. So I just kind of try to help them to change that outlook, move a little bit differently in a positive direction. Well, I haven't had any problems with my clients as far as seeing them through telehealth. A lot of them find it to be a little bit more convenient because of their busy schedules. So I haven't had any issues or concerns with seeing any of my clients via telehealth. Well, I know I've done a good job when we run out of things to talk about. That's number one. And then number two, a lot of the concerns that they had when they first met with me, they've now learned how to address those concerns in a positive manner. And I learned that I'm no longer needed for that client. And so that's how I know I've done a good job.